Imagine for a moment surgery without the need for knives or needles or even incisions at all, where energy can be directed from outside the body to a precise target point inside the body to destroy overgrown tissues, tumors, or cancers. This is histotripsy. So the way we do surgery now has really evolved dramatically.
So originally people would go in with a knife and be able to open people up.
In the past, open surgery was the only way to destroy tumors, remove tumors or organs or overgrown tissue.
And then they started making very small holes and putting surgical devices.
Laparoscopy more recently has radically changed anesthesia, surgery. CT scanning were all major paradigm changing technologies or interventions.
But the ultimate is really to be able to apply the treatment actually through the skin and never have to actually open up the patient at all.
The sound waves transmit through the overlying tissues without affecting them.
Basically surgery at a distance.
And also the treatment can be really fast.
This technology promises to revolutionize surgery
without having to even put somebody under sedation.
Let me give you an example. So we can create the flow channel in the atrial septum in the heart in about 1 to 6 minutes.
with nothing entering the body except for energy.
Compared to the surgical procedure that's done currently, that would take 4 to 8 hours, and you're talking about a whole team of surgeons and nurses.
So that's going to be a huge game changer.
So that patients suffer less pain, have shorter recovery. There's no scar or incision to
It doesn't
heal.
leave behind scar tissue.
And in fact, this probably could be done in the office instead of an operating room. Bubbles.
Bubbles,
Bubbles.
bubbles.
Lots of little bubbles.
So almost from the beginning of ultrasound therapy research, it was noted strong sound would create little voids within the tissue.
Because we breathe in air, there are nanometer size tiny gas pockets in our blood and in the tissue.
And when an ultrasound pulse that's of a sufficiently great amplitude comes through, it can cause it to expand, and that expansion happens in a very explosive manner,
So these are like little micro explosions.
in a process that's referred to as
So
cavitation.
acoustic cavitation, meaning that you can use ultrasound to activate the tiny gas pockets in our tissue and eventually remove the cells and tissue that way. So we thought that can be a potential mechanism. But at the time, cavitation was known to be unpredictable and uncontrollable.
People felt it was an uncontrollable phenomenon and should be avoided.
So no one was able to show that you can actually harvest energy to control cavitation to perform the surgery we talk about. It was unthinkable and impossible at the time. But that's why science is interesting, and that's why we do what we do.
What people had always thought was something to be avoided, which was the production of a cavitation event inside of tissue during treatment, was actually a tool.
So in 2001, it was science fiction.
The first response we typically get from people looking at this technology for the first time is disbelief.
The first time that we looked at actually drilling through tissue, then you could see it.
Just people don't believe that we actually got that results. It was impossible.
And you realize, wow, you can really do this. As opposed to having surgical knife that's doing the cutting, you actually have this bubble cloud that's eroding the tissue away from the inside out.
And the fact that we are making the impossible work, that was extremely exciting and satisfying.
The histotripsy focus is very small. It's 1 millimeter diameter or less. And in order to create a shape like this block M, which is 1 centimeter by 1 centimeter, we move that focus in the pattern of an M to paint out the entire zone we wish to treat. In this case, the pattern of a block M.
Pediatric cardiologists, clinicians, liver cancer surgeons, intravascular cardiologists, neurosurgeons. Everybody I talk to, when they see the potential, they basically says, tell me when we can use it.
It's a platform.
And it has a wide range of medical applications.
Histotripsy can be used to treat many different diseases in different organs. In the kidney, the liver, pancreas, including the uterus,
Cardiovascular conditions.
As a treatment for
fibroids,
stroke,
the vascular system,
liquefy and drain blood
and
clots.
plaques in arteries and veins.
Particularly interested in looking into the brain tumor right now.
We applied in the heart, the adult heart, as well as the pediatric heart, and even in hearts of unborn children.
You know, the men always identify with the prostate.
And there are many, many other applications.
It's going to make your life better,
It seems almost limitless at this
and
point.
it's going to make your life a lot better than the current procedure.
People see a demonstration or understand the potential of this technology, they're hooked.
Believe me, I have in-laws, not in-laws, I have family members who would like to line up for this as opposed to what they're going to face otherwise.
I'm really psyched about histotripsy, this new technology, because I think it really will change the practice of medicine.
And that's what's exciting, because it's a whole new area of exploration.
So I can envision a future in medicine where we can replace a lot of cutting the body open.
So patients now needing surgery in an operating room and recovery in a hospital could come into an office. And a handheld device, potentially, with a small imager could be used to destroy the tumor in their kidney or liver.
Right on the spot, at the time of diagnosis.
And they could go home the same day.
And the patient can go home without a lot of worry about the future.
Histotripsy is the way that surgery will be done in the future. And this will be widespread. It won't be limited to just large academic medical centers. But there's still a long way to go to make this a technology that's present everywhere across this country and around the world.
Histotripsy, where the scalpel stays on the table and you, the patient, don't. That would be pretty good. That would be pretty good. And you can get up and walk away from surgery, because that's really what you're talking about, right?